Hi there, welcome to the Physios in Sheffield. My name is Johnny Cassidy, I'm one of the team here. I'm joined by my colleague Paul, and this evening we're just going to have a really brief conversation about osteoarthritis of the knee. Now Paul, you're the principal physio here, you're our chief injection therapist. Can you tell us a little bit about your journey and injection therapy for physios?
Yeah, I qualified a long time ago, but when I qualified, injection therapy was done by doctors, by consultants, and it wasn't within the scope of physio, but I could see from a really early stage how those two things were really well connected, and it seemed to me that physios were the people that should be doing this because we were able to incorporate injection therapy with rehabilitation and a kind of holistic package to get the patient kind of better, rather than it being done by disparate, separate people. But it wasn't until 1996 when the Chartered Society of Physiotherapy allowed injection therapy to be part of the scope of the physio, and I was on the first injection course to train, and I gradually incorporated it into my practice, and I could really see the benefit of being able to do both. Mm-hmm. And in those days there was only a handful of people that were doing it, but a few years later, I then developed a new course which is still running, and over the years we have trained something like 2,000 physios and doctors in this skill, and that's just something I really enjoy doing still, as well as obviously using injection therapy as part of our clinical practice.
Yeah, so this evening we're here to talk about osteoarthritis of the knee, a big problem for a lot of people. Could you just shine a little bit of light on why osteoarthritis of the knee is so prevalent?
Yeah, I think the main reason is that it's a key weight-bearing joint, and it's also the way that the anatomy of the knee, the way it's built, is that it's a hinge joint, which basically means that it moves in one plane. It bends and it straightens. There's a bit of rotation in the knee, which it needs. But there's a lot of force going through the knee, particularly in weight-bearing positions. So you think about, people playing sport, even just simple things like going up and down stairs. Every time the knee bends, there's a lot of contact pressure between those surfaces. Now the knee's designed to do that, and in a healthy knee, it's not a problem. But really where arthritis develops is often maybe 10, 20, 30 years earlier, where there's been an injury, and maybe there's been a meniscal tear, a cartilage tear, or an ACL injury, and that disrupts the normal mechanics of the knee and leads the knee to developing wear and tear changes over time. Yeah, tissues also get a bit less resilient as well as you get older. So, it's a really common condition, and just to give you some idea of scale, it's been estimated that there's about 3.8 million people in the UK with osteoarthritis of the knee. That's from the age of 45 onwards. So a vast problem, and how often we how much of our time we spend treating the condition.
Yeah. So I suppose I've been part of the clinic now for a while, and I was aware of injection therapy before I came here, but actually my knowledge and awareness of injection therapy has really rocketed since I joined you. Just specifically relating to osteoarthritis of the knee, how can injection therapy help? And there's a lot of fog out there and miscommunication. Steroid and this new thing, hyaluronic acid, and can I only have 3 injections? And there's just a lot of confusion there. Could you shine a little light on that, please?
Yeah, I'll try. I mean, I think we've all heard stories about the ex-professional footballer who's had repeated steroid injections throughout his playing career and now can't walk. And it's a rather kind of grim consequence of steroid injections, and as a result, they've got quite a bad press. Now, in some ways, that's probably right, because we know that repeated injections, repeated exposure of steroid into the knee or any joint is not healthy, is not good for the joint. So now, these days, we're much more careful about the use of steroid. And the 3 per year is an absolute outside maximum, but I can't remember ever doing it that frequently, because generally speaking, if people aren't getting a response, and a good response for a period of time, it's not something you want to just keep repeating. There are better treatments and potentially surgery out there as well. The thing that's come along more recently over the last few years is this high hyaluronic acid, which you mentioned. And high hyaluronic acid is a molecule that's naturally occurring in every synovial joint. It's there, and it does a job in terms of absorbing stress and load, and it also provides viscosity, which allows the surfaces of the joints to move smoothly on each other. What we know is that in the degenerative arthritic picture, this molecule is degraded, and so there's less of it, and that's part of the wear and tear process. So we now know that by injecting synthetic high hyaluronic acid into a joint helps to restore the normal conditions within the joint, and thereby reduces pain and improves function. Yeah.
Nice. And I suppose just for people watching, just to give you a bit of a chronological marker of where we are today, we're currently in the middle of this COVID-19 pandemic, and we know there's loads of people who've possibly been waiting for knee surgery, that's been cancelled or postponed, and we also know that there's probably going to be a significant wait when things get back to normal, or this rubbish phrase of the new normal. Is there anything that injection therapy could potentially offer these people? So say there's somebody who's got a knee and they're really struggling with it, and their surgery's been pushed 3, 4, 5 months down the line.
Yeah. Well, steroids are not a good treatment option for those patients, because we know that it's, as well as being a powerful anti-inflammatory, which is a useful thing, it also suppresses the immune system. So that's not something you'd want to do with a patient who's just going to have an operation. However, high hyaluronic acid, there's no concerns on that front at all with HA, and it has been shown to prolong the life of even joints that are on their way out, so to speak. And I can think of, we both know this patient because you treated him as well, but I can remember Jeff, who came along and was really keen on having an injection, because his wife had one and she'd done really, really well with it. And when I examined his knee, it was clear to me that he needed surgery. And so we had a 20-minute conversation, and I was just explaining that really injection wasn't going to be the best thing for him, and he needed to get on the waiting list. But he would not have it because he was going away on a business trip, and it was really important for him to be mobile. And in the end, once we'd kind of discussed it endlessly, I agreed to do the injection, because I knew that there's a chance of therapeutic benefit, but and it wouldn't do him any harm. And I injected his knee, and 3 weeks later he sent me an email, which was really great. He said that he'd been walking up and down the stairs without holding onto the handrail, which had been impossible before. He'd walked up to a mile, pain-free, on uneven ground, and he was so delighted with the outcome. In the end, he pushed back surgery about 18 months, a couple of years, and was able to function really quite well during that time. So he's one that sort of sticks in my mind, because he was one person that I really didn't think would benefit, and did really well.
Wow. So that was a short conversation. We try to keep it brief. I've got lots of questions in my head even now that I would like to ask you. Maybe we'll do another video with a few more questions. But there's lots of information on our website, so www.thephysios.com. Lots of information on hyaluronic acid, injection therapy, and you can get in touch with us should you want to ask us any questions. But yeah, hopefully we will pop another video together just with a few additional questions about, can the injections be combined, that sort of thing. But we really hope you enjoyed a little bit of information on knee osteoarthritis and how injection therapy can help.